patients be also omoba ehono CEO on the hospital no facility no say be say ayamo say so into some of the patients to just go home and die. We are dying as already. Akache CEO say on chain. Now, yampe solution to the problem because it looks like he does not have any solution to the problem now. Can next be one be juma or confonochi me pamon? I will sack you. It is unquasi. I didn't bring you crumble to you. Say, ye see you no. Na see you no. Obe juma or whenever juma. Nipa no fast see you when juma say you. So who are you to say you are going on strike? See you na block emergency. Why a man to be a man? And I'm also with Jimmy someone call hospital. And the omwa yadi omoba yadi omo back omo wunu. When you blame no. When a cause the death. And the President of the Republic has the right to fire and hire at any time. So when the President of the Republic comes out and gives a strong directive that it does not matter your facility, it does not matter. The life of a Ghanaian is important than anything else. You can. That is why I cannot be CEO of Konfanoche. That is why I cannot be CEO of Kolebu. That's why I cannot be CEO of Tamale Teaching Hospital. That is why some people have been given that work to do. That is why some people are paid huge amount of money every month. That's why some people get some perks that I can't get because we see them say they can take care of some tasks I cannot take care of in the professional field. For you to be appointed as the CEO of a facility, you need to understand it comes with a lot of responsibilities. Decisions that at the end of the day, you might not want to take but have to take. And at the end of the day, the most important thing that your employer, at the end of the day, whatever instruction he gives you, you need to follow it. That is how it works. Because you, the CEO of whatever institution or government institution, wafa obiwa as a supervisor, no, they are also telling the people beneath them, their subordinates, that boss will not allow me to work if this thing is not done. So, yati no, na patients be also omoba ehono CEO on the hospital no facility no say be say ayamo say so into some of the patients to just go home and die. Now, that actually triggered the ACC and the health minister, no, extra letter, the CEO say, you need to step aside. Yeah, before we say, we are CEO of Konfanoche. You knew what Konfanoche, the problem Konfanoche na AFM. You are not new to this. You are not new to this. You got all the accolades. People started cheering you on. Their job is in your front. So at the end of the day, I don't expect you, the CEO, to make it look like, Sebio, you didn't know what you were coming to meet. You knew it from day one. You knew it. That is why because we all knew the problem. The idea for all you know, you have even worked there before and you know. Until now, you were not supposed to take the job. So why do you today, Matissa, say, abino through the Ministry of Health, Akache CEO say, on chain. Now, yampe solution to the problem because it looks like he does not have any solution to the problem now. Nobody says that Konfanoche is perfect. Everything is perfect. But if you're a CEO and you cannot improvise, you cannot basically think on your feet and make some decisions, then it means to say, if you are going, the only solution is to drive patients away to go die there. Then we bring somebody in who can at least move things around and save lives because with healthcare, it's all about life saving. That is the most important thing. In Taban said, Jinanchain, it looks like, say, you are not prepared. Because time and about the CEO of Konfanoche, none of them say, and yet go into the hotel. You know, the Konfanoche has its own problems. And this was going to happen. And for you to say, oh, where the and some doctors suspended Konfanoche Teaching Hospital CEO appeals to striking doctors, nurses, and midwives to resume work. You see, President directive Omaye CEO we in this through the Ministry of Health yaka say on tonight chen kakra no you say nurses are omo hospital ho any doctors say almost so there akọ strike la aban no e problem and I say aban no can some na nurses and doctors and you see sadie way akọso power Konfanoche pa so wo hwe Ghana your regional hospitals are Konfanoche be a political hospital. And I'll say this without mentioning any words. The media in Kumasi, anytime you will be as the CEO of Konfanoche, na omudi bibia ko tare no ho se odum for ba. Me a health minister, can nurse be one be juma or Konfanoche me pamon, I will sack you. Because Ghana, we are not in need of nurses, so we have a lot of nurses at home. We have a lot of doctors at home. We have a lot of professionals waiting to get employed. It is unquasi. I didn't bring you crumble to you. Say, ye CEO no, na CEO no obe jwana oho. Onefa ojuma. Nipa na ofa CEO na juma nseme you. So who are you to say you are going on strike? Do you know what happens up there? Enti ye jiminti na ye nye adwuma ni wiane adane kwasiafo. Oh, we want jobs, we want to work, we want to work. CEO ni CV. Ye ni interview na wo ho. The CEO, ye interview CEO now what will be. You came to work as a professional. You were juma. Na say ejuma na a association, and I say a daba, and I say a kuo dia. Mama you say a makuo, a mema kuo. Ni you say a treat mu as their group upon groups. But the foolishness of some of these nurses and doctors, the sense of entitlement. As a muni answer. Now the question here is, CEO now block emergency. Say, why a man to be a ma? And I'm also with Jimmy Salmon Hospital. And the omwa yadi omoba yadi omoko back omo when you blame when a cause the death. Abrochira, and majority of you these nurses and doctors, and most of you go to jail because it is pure negligence. What is your basis for staying home? My basis for staying home or driving away the patients is because my CEO has been told to step aside. Kwasia, you'll be sacked the same day. What is your basis for staying home? What is your basis for not working? My basis for not working is that the CEO, I think that the health minister doesn't like him, so I'm also not going to work. Go and check your oath. Go and check a human found documentation about DNA. Are you working for the CEO or you are working for the government of Ghana? You are working for the people of Ghana. So go back with your dirty asses and go work. Want to mean resign and go to UK and go clean white woman's asses. Because therefore, what is Ghana? The mama juma kakrasa munya, number some hand tiny paso. Mukwa brocha and kwasi juma na muye, motiti bini. Mubedru Ghana, number can tiny paso. Yanimu. Most of you, mobile brocha, want to mean yejuma, a chamusako another course. Near realize some muye nipa obetume yejuma. You sit in Ghana, we give you all the privileges, we try our best to help you people. Munya juana, munya tala munin so namu kan kwasi asem. Doctors bebre wa Ghana, abrocha want to mean doctors. It's a fact. You don't read your job. You don't read anything. Yeah, the people shows are not assigned. And most of you come in here, health minister, and can come a pamumunina. Now, ya pamumwa 100,000. You bring 100,000 as something. Yes. Now, Ghana ni ejimintra, we make some of you people feel say you are too powerful. Most of you, mutu kwa every Ghana, muntu mi nyejuma hospital. Yana sebio yejimi kakra, and yes, so. Anytime people say, and there's obi wu. Ye di obi ba emergency na ye ntumi agene kwa na owu a hwan ekunu eyewo negligence straightforward. The government is dealing with the CEO. His issue is different. What about you? You need to do your job. CEO nintina about konfonachi. CEO nintina oba hospital ejumem. CEO nintina oba salary. You are not working for the CEO, you are working for the government of Ghana through the Ministry of Health. So your job is to make sure you save lives. Whatever the CEO is going through, it's his problem, not your fucking problem. Ghana registered nurses. San kwasiafo na mo say kuro no. Ehu mu abrochire. Mo bedru abrocha ma say slaves. Mo ye adwuma say moa. Na mo tete Ghana pandia nkwa na mutumi bo. Ene kwa na kwa mutumi mbo. Lazy fun ena bandage tantan bi. Mo nya adwuma no so no. Wo ye adwuma ma CEO ara so wo ye adwuma ma Ghana ban. CEO de chauka. Are you paid by the CEO? We are not going to work because they have taken our CEO. Is he running the brothel there? Or running a jantra for school? You are a nurse, you are a professional. Your job is to do your job. His job, or not nipa of the job or the deal. Is it your problem? I don't know move Jimmy sir. Mumra broche, move a broche myself moi. A form a man for Finamo Pipati and Gramine. Ghana, you treat him with nipa. Your mama respect. Now, we see the kind of attitude that some of you nurses and doctors you give people in the hospitals. Yeah, who need to be a Sanke the ethics yamujumana kamunya kamutitifi. Yeah, share a juman who rules and kamu bebre 90% kamugufie. Inti ayana sometimes mumubi munya nyansa kakra na Jimmy Dawson. Weja over 20 NDC. That is my padia. I don't fucking care. I am telling you the hard truth. If you don't want to work, get out of here. People are home. I'm on for a demonstration. I'm on for soon. I'm on for here juma. When you're doing it, also Jimmy. Yatiami CEO and Timmy juma. Oh, you're giant as already. And the menoka say, Obia wanadri. Whose negligence is that? It is your negligence. You have to go to jail.